Assalamualaikum guys, today we are discussing the abdominal quadrants and their clinicals. First of all, if we see the abdominal quadrants, the abdomen is divided into 9 quadrants by 2 vertical lines and 2 horizontal lines. The 2 vertical lines extend from the mid-clavicular line to the mid-inguinal lines, right and left simultaneously, and then the 2 horizontal lines are 2 planes. Number 1 is a plane that is the transpyloric plane at the level of L3, and there is a transtubercular plane that passes from the intertubercular ischial spines, that is the transtubercular plane that is at the level of L5. The 4 lines divide the abdomen into 9 quadrants. Number 1 is because there is rib cage above, so the right and left hypochondrium. Hypo means below and chondrium means the cartilages. So left hypochondrium and right hypochondrium. Between this, the midline is divided with the reference of umbilicus. This is the umbilical region, and above the umbilical region is the epigastrium. Gastrium is above the umbilicus, and this region is hypogastrium below the umbilicus. Further on, there are 2 kidneys, and so this is known as the left lumbar region and the right lumbar region. Below there is the hip bone, where there is the iliac bone, iliac fossas. So these are the left iliac fossa and right iliac fossa. If we repeat the quadrants, this is left hypochondrium, the epigastrium, the right hypochondrium, the left renal area or the left lumbar area, then the umbilical region, the right lumbar or right renal area, then this is the left iliac fossa, the hypogastrium below the umbilicus, and this is the right iliac fossa. Further, if we see the organs, as we have to see the clinical, so we should know about the organs which are present. In the left hypochondrium, there is part of your spleen and the stomach, or the fundus of the stomach, and the part of the body of the stomach and the spleen lies in your left hypochondrium. In the epigastric region, there is some part of your liver. This is your pancreas and the lower portion of your stomach. In the right hypochondrium, there is liver. The major portion of the liver lies in the right hypochondrium and the gallbladder. So further on, if we see the lumbar regions, there are kidneys, retroperitoneal, because there are posterior structures, and we see the ascending colon and the descending colons respectively on the right and left lumbar regions. If we see the umbilical region, there is transverse colon, the duodenum. First part of the small intestine is duodenum, then the jejunum, and some part of the ileum. Then in the right iliac fossa, there is the ileocolic junction. Ileocolic junction stands that there is junction between the ileum and the colon. Colon is your large intestine, and the first part of colon is cecum. So ileocecal junction or ileocolic junction, it is the same word, and there is appendix. So the pain of appendix, we will discuss later on. Now, if we move forward, in the hypogastrium, there are ureters opening into the urinary bladder. Now, if we discuss the pains in the abdomen, first of all, if there is pain in your left hypochondrium, that shows there may be injury to the spleen. Splenic rupture can be followed by a kick on the left side of the abdomen to the 10th and 11th rib, and the splenic rupture is the most vulnerable organ. So if splenic rupture occurs, there is bleeding and pain in the left hypochondrium. If there is gastritis, which is common in our Asian society, GERD, gastroesophageal reflux disease, so pain will occur in the left hypochondrium and epigastric pain. These both represent the pain of the gastric ulcers and the GERD. First, if we move forwards to the epigastrium, the pain in the epigastrium may be due to the pancreatitis. Pancreatitis is inflammation of the pancreas, and pancreatic carcinoma. The first symptom of pancreatic carcinoma is pain in the epigastrium that is going behind, because pancreas is a retroperitoneal structure that extends forward to the backwards. So if the pain is in the epigastric region and it is referring back, so that signifies your pancreatitis, acute pancreatitis. If we move forwards, in the right hypochondrium, there is the pain of the gallbladder. When there are stones in the gallbladder, that is known as cholecystitis. Cholecystitis, stones in the or inflammation of the gallbladder, and cholelithiasis means the stones in gallbladder. Both cholecystitis and which is caused by the stones, this pain occurs in the right hypochondrium, and it is associated with green vomiting because the bile is greenish in color. So when we vomit out with the gastric contents, the color of the vomit is green in color because of the bile. So green vomiting and pain in the right hypochondrium and fever. This is a triad of cholecystitis, and the right hypochondrial pain refers to the acute cholecystitis, which is due to the cholelithiasis, gallbladder stones. Moving forwards, if there is pain in the right and left lumbar regions, that shows there is pain in the kidneys. Kidneys pain may occur due to dehydration, or there is renal carcinoma, or we can say there is inflammation of the kidney or the renal calluses, glomerulonephritis. And if there is stone in the ureteric stones, then the pain will occur from the lumbar region to the hypogastrium. So a pain radiating from the lumbar region to the hypogastrium shows that there is a ureteric stone in the ureter, because ureter is extending from the lumbar region to the hypogastrium. And if there is any urinary tract infection, so it will ascend from the hypogastrium to the lumbar regions. Urinary tract infection will ascend from the hypogastrium to the lumbar regions, and ureteric colic will descend from the lumbar region to the hypogastrium. And if there is any carcinoma or pain in the bladder, that will occur in the hypogastrium. So pain in the hypogastrium will show that there is any problem in the urinary bladder, or there is UTI. UTI means urinary tract infections. And now moving forwards, if we see the right iliac fossa, that is very important because there is the presence of appendix. The appendicular pain. Appendix is a vestigial organ that has no as such a function, but it is situated behind the ileocolic or ileocecal junction. This is the cecum and this is the ileum. So it is behind, or there are 9 o'clock, 10 o'clock, 12 o'clock positions. We have referrals due to the presence of this organ on different sites. If the organ is appendix is inflamed, this is known as appendicitis. The pain of appendicitis is most common in the right iliac fossa, and some may occur in the hypogastrium due to the presence of this organ. If mostly there is a right iliac fossa pain. If the patient complains of severe right iliac fossa pain, it may be due to and it is referring to the right lumbar region or the hypogastric region. So it may be confused with the UTI and the appendicitis. So we will differentiate it with the complete blood count, which will be WBCs will be raised, that shows an infection. In the umbilical region, umbilicus is an indentation in the skin, so infections may occur while taking shower, or any other infections may be referred to the umbilicus, and the umbilical infections are very common. And there is umbilical hernia. Umbilical hernia is situated here, and if there is paraumbilical hernia means in the vicinity or the surroundings of the umbilicus. The umbilical hernia is a situation in which the contents are transformed from a normal position to the abnormal position. For example, in the umbilical hernia, the contents will be loops of small intestine, because behind the umbilicus there are running the loops of small intestine. So the umbilical hernia consists of loops of small intestine. In the previous lecture, we have discussed the layers of the anterior abdominal wall, which extend from the skin. Then there is the subcutaneous fascia. The subcutaneous fascia underneath goes to the superficial fascia. The superficial fascia is divided into two, the fatty layer and the membranous layer. The fatty layers is the Camper's fascia, and the membranous layer is your Scarpa fascia. Behind this superficial fascia there is deep fascia, and deep fascia, underneath this deep fascia there are three muscles, which is the external oblique, internal oblique and transverse abdominis. These three muscles overlie or cover a muscle that is your rectus abdominis and form a rectus sheath. That is the extension of the three muscles, or the aponeurosis of the three muscles, that are external oblique, internal oblique and the rectus transverse abdominis. Behind these three muscles and their aponeurosis there is the rectus sheath, and then there is the fascia transversalis Underneath there is extra peritoneal fat, and then there is the parietal peritoneum that is linked with the upward and downward to the viscera. The peritoneum is a jelly-like structure, or which connects or covers the viscera individually. So, if it is connected to the parietal, means the upward, and visceral means the viscera. Because there is the visceral peritoneum that is attached to the abdomen, like the stomach, the greater omentum, lesser omentum, and to the large intestine, like the mesentery of the sigmoid colon and the largest mesenteries of the small intestine. These mesenteries is the extension of the peritoneum. So if infection occurs in the membranous layer is the third layer after the skin and the subcutaneous tissue. Then there is the superficial fascia. The superficial fascia has a fatty layer and a membranous layer. The membranous layer is adherent to the fascia of the thorax, and below it is adherent to the fascia lata in the lower limbs. If the extravasation of urine occurs when this membranous layer extends in the penis and the scrotum as the Cooley's fascia. When there is a rupture of the penile urethra, the urine is extravasated in the Cooley's fascia, and the Cooley's fascia extended through the lower abdominal wall through this membranous layer, because it is continuous, but it does not go in the thigh because there is a demarcation, and the fascia lata is a very strong structure. Overall, the abdomen is soft in consistency, and it is contour. The contour is not rigid. You can palpate the muscles easily and the abdominal viscera. But if there is any infection or inflammation of any organ, like gastritis or cholecystitis or appendicitis, then the quadrant becomes inflamed or becomes tender. Tender word is used when the specific area of the abdomen is inflamed underneath, and when the patient is examined by palpating, the patient feels pain in the specific area. For example, in cholecystitis, the patient will feel, or this area will become tender of the skin and the superficial fascia. The right hypochondrium will become tender due to cholecystitis beneath. So the contour. And secondly, if in lower abdominal wall muscles, there is the tone of the muscles which forms the contour of the abdomen. If these muscles are weak, for example in a multiparous woman with multiple pregnancies, the lower abdominal viscera are protruding out. This is known as visceroptosis. This is not a clinical or a diagnosis of the ovarian tumor, but is just a appearance of the abdomen. Then the rectus sheath. The rectus sheath, as we have discussed, is a layer of the aponeurosis of external oblique, internal oblique, and the transverse abdominis, which cover a muscle that is inferior epigastric artery, or the vein is ruptured due to a kick or any abdominal trauma, minor abdominal trauma. And then the rectus sheath is inflamed, or there is hematoma or bleeding that is collected in the rectus sheath. So the pain is in the midline anterior abdomen. There is pain in the midline anterior abdomen, and you can find a mass in the location of the rectus sheath. And the abdominal anesthesia is because the nerve supply is the anterior and lateral rami of the T7 to T12 and the L1. So the anesthesia is given from the behind the costal cartilages from the xiphoid process, which is at the level of T7. So xiphoid process and the 10th and 11th rib, behind these the needle is inserted, and the T7 to T12 nerves can be blocked. The L1 is blocked. The iliohypogastric and ilioinguinal nerves can be blocked due 1 centimeter above the anterior superior iliac spine in the superficial inguinal ring, because these nerves passes front and behind to the superficial inguinal ring. And further clinicals we will discuss as we study the further topics. Thank you.